Hi, in this video we'd like to talk about another important topic on Hyperemesis Gravidarum. Today we'd like to talk about a specific symptom, a secondary disease that affects a lot of women, even women outside of HG during pregnancy, which is comorbid depression. This is especially obvious and persistent in HG patients. This form of depression that forms during hyperemesis with the symptoms of severe nausea, severe vomiting, insomnia, salivation, there's always a lurking symptom that is looming over them throughout the entire period, which is this depression. Now we can diagnose this to be a major depressive disorder. It's quite clinically severe to the point where it causes anxiety, it causes stress, and it causes them to have an emotional numbness, some kind of anger, several negative emotions mixed together into a bundle. This is what they're experiencing, and it's very hard for them to feel any sort of joy or happiness during this pregnancy. So they'd like to associate the pregnancy with this sadness. This ends up causing them to withdraw socially. They are having more quarrels with their loved ones, their husbands, their in-laws, their family members, and then they even develop feelings like frustration, anger, jealousy. All of this can be explained because of the presence of this comorbid depression. Now, why these women develop this depression during hyperemesis gravidarum? Now, this doesn't only apply to HG patients, this can apply to any other mother in her pregnancy. It's because there's usually a history of a pregnancy loss that was not dealt with emotionally because of the pregnancy loss. It's especially severe for HG patients because they've suffered hyperemesis during each of their pregnancy, and each pregnancy ended in a pregnancy loss. So you can imagine if they've miscarried 3 to 4 times, they're trying for a child, and this pregnancy again, the depression comes more stronger, much more severe. It's because of the previous trauma. This is quite severe as well, and not to mention the symptoms of HG, how severe it can be. We are all very familiar. It can affect them physically and mentally. That's why this condition definitely needs a treatment. So for these types of patients, when they are very anxious and afraid of their next pregnancy because they know they have this depression that are usually associated with pregnancy, it usually comes very strong with pregnancy. In this type of patient, we recommend them to seek treatment with us before pregnancy, where we will prescribe you specific antidepressants, anti-anxieties that you will need to take before you conceive and throughout the entire period. Now, you don't have to take it throughout the entire pregnancy period. You need to take it until your hyperemesis gravidarum is treated, fully treated, where the symptoms are elevated, your quality of life is restored. So there will be special instructions for you, but you will still need to have your HG treated with our HG vaccine. And with our HG vaccine, you will see full recovery very quickly. And when you see full recovery, then you can go off the anti-anxiety medication. Now, why we want you to take this before pregnancy is that because if you wait until symptoms show up and then receive treatment for both hyperemesis and your depression, it'll be much more difficult to treat because this form of HG with comorbid depression is, in our experience, the most complex to actually manage and treat it properly. That's why we want our patients to receive the medication, eat the medication before pregnancy. In that way, there will be no symptoms. It's very easy for you to have a successful, healthy pregnancy, smooth one. But it cannot be always that case because many patients, especially first-timers or those who have not heard of Antai Hospital's protocol with hyperemesis gravidarum, usually they come to us in the midst of hyperemesis and they've already have severe depressive symptoms. And this type of patient, you will need to be hospitalized. There's no other way. We cannot allow you to discharge and just have your HG treated and then send you home because the depression is still there. It may cause some further complications. So this patient needs to be hospitalized until we can manage the condition fully because we need to manage what she's eating, the anti-anxiety and antidepressant dosages and the volume that she's taking, and also the timings. All of these are very important factors so that we can manage this condition fully during pregnancy. Now, Antai Hospital does offer an effective treatment for Hyperemesis gravidarum, which is our HG vaccine. And we've seen that Hyperemesis gravidarum comes in many complex, many difficult forms, and it definitely affects mothers' chances of having a successful pregnancy. Plus, they are also suffering a lot. And this video serves to actually give you an idea that we here at Antai Hospital can treat your condition, no matter how complex it is, and especially depression, which is a manageable condition and can be treated and avoided. It is not a state of mind, it's simply associated with past traumas and further amplified by Hyperemesis gravidarum. And the only way to overcome it and to restore quality of life, restore relationship, restore your mood, is to have Hyperemesis gravidarum treated and the comorbid depression eliminated at the same time, which we can do that here at the hospital. So I hope that this video has answered your questions on comorbid depression with Hyperemesis gravidarum. Now, this applies to all mothers who are seeking our treatment. Regardless if you have HG or not, depression is a common symptom during pregnancy. Please get in touch with us via the website at www.antaihospitals.com. You can talk to our consultants to make some arrangements happen. Please stay tuned to the next video and leave me some comments down below.